How does dehydration affect a child's brain, heart, and kidneys? Imagine a child's body as a busy city where every part needs water to keep things running smoothly. When a child becomes dehydrated, it's like the city is running low on water, and that can cause big problems for the brain, heart, and kidneys. Dehydration happens when a child loses more water and electrolytes than they take in, often because of vomiting, diarrhea, or not drinking enough fluids during illness or hot weather. If not treated quickly, it can become serious. The brain is about 73% water, so it is very sensitive to dehydration. When a child is dehydrated, the balance of electrolytes like sodium gets disrupted. This imbalance can cause confusion, headaches, and in severe cases, seizures or even loss of consciousness. If dehydration continues for a long time, it can affect how the brain develops and functions, especially in young children. This is why keeping children hydrated is so important during illnesses. Dehydration also affects the heart. When a child loses a lot of water, the volume of blood in their body decreases. This makes blood pressure drop and reduces blood flow to vital organs, including the heart. The heart then has to work harder to pump blood, which can cause irregular heartbeats. In very severe cases, the child might go into shock, a life-threatening condition where the heart cannot pump enough blood. Electrolyte imbalances caused by dehydration can also disturb the heart's rhythm. If fluids are given too quickly or improperly, it can lead to fluid overload, which might cause swelling in the lungs or heart failure. The kidneys are like filters that clean waste from the blood and help control fluid levels. When a child is dehydrated, less blood reaches the kidneys, which can cause them to stop working properly. This can lead to a sudden decrease in urine output and the buildup of waste in the body. If dehydration is not treated promptly, it can cause lasting damage to the kidneys. Since children's kidneys are still developing, they are especially vulnerable to injury from dehydration. Children are more prone to dehydration than adults because they have a higher percentage of water in their bodies, faster metabolism, and a larger surface area relative to their size. They might not always recognize or tell someone they are thirsty, especially when they are sick or playing outside in the heat. Mild dehydration might cause tiredness, headaches, or nausea, but severe dehydration can lead to serious organ damage or even death if not treated. To manage dehydration, it is important to watch for signs like dry mouth, fewer wet diapers, tiredness, rapid heartbeat, or dizziness. Mild dehydration can often be treated with oral rehydration solutions, which are special drinks that replace lost fluids and electrolytes safely. For more serious dehydration, doctors may give fluids through a vein, but this needs careful monitoring to avoid complications. If a child shows neurological symptoms, very fast heartbeat, low blood pressure, or little urine, they need medical attention right away. In summary, dehydration can seriously affect a child's brain, heart, and kidneys by disturbing the balance of fluids and electrolytes and reducing blood flow. Prompt treatment with fluids and electrolytes is essential to prevent lasting damage and help the child recover fully. Always consult healthcare professionals if you notice signs of dehydration or if a child is very ill.